Detroit Lions wide receiver Amon-Ra St. went down with a right leg injury after getting rolled up on. Let's break this down. We saw the medical staff evaluating that right ankle. On injuries like this where it's not clear whether there was an inversion or eversion injury, the staff will stress the low ankle and high ankle ligaments to determine which one reproduces pain. Common tests we'll do here is the Tyler tilt test to test the low ankle ligaments, which would favor an inversion, and the dorsiflexion external rotation stress test, which stresses the syndesmosis and the high ankle ligaments. Looking at both the views, we're not able to see if the foot inverts in the classic low ankle sprain mechanism or if it is everted in that high ankle pattern. It is reassuring that he was walking off on his own power because severe sprains or fractures usually don't allow for this, and we typically see players getting helped off or even carted off in severe cases. He'll get an x-ray in the locker room to rule out an acute fracture. An inversion sprain is often playable because the injury is limited to these lateral ligaments. Taping can block inversion while still allow straight line running and controlled cuts. Swelling stays lateral, the tibia-fibula complex stays stable, and the ankle still works like a hinge, letting force be redirected away from the injured tissue. However, a high ankle sprain is very different. The syndesmosis stabilizes the two bones of the lower leg, the tibia and fibula, and every step requires these two to work together. So motion that pry this fork apart directly stress the injury. Now you can tape an inversion, but you can't really offload a high ankle syndesmosis, which is why high ankles cause deep pain, loss of power, and why mild to moderate cases often try to return but can't, like what we saw with CD Lamb earlier this year that cost him around 4 weeks. Swelling is also much worse the next day. Best case scenario here, if inversion, most can be played through with tape, and the more significant ones can cost 1 to 2 weeks with some dips on cuts and acceleration. Worst case, if it's a high ankle, average is around 3 weeks, with moderate being 4 to 6 weeks out. If it's non-surgical, wide receivers will show less burst, less ability to push off and slower route transitions. Hopefully it's a low-grade injury. Wishing Amon-Ra St. a safe and speedy recovery. Happy